Now, Aneesh, you can see there's a lot of love in this room.
Yes.
People have been basking in the power and the glory of the network.
Yes.
The power of the individual, connectivity.
Yes.
Now, you represent big government. Are you here to spoil the party?
Lowercase g.
Isn't government the opposite of everything we've been talking about here all day?
Absolutely not. What is exciting about where we are today is that for the key sectors of the economy that need the capabilities of networking and information technology, invariably they are affected by policy. So an effective government that's a partner can actually do a better job of opening up the potential for networking and information technologies to have actual impact on the sectors of healthcare, energy, education, manufacturing, and dare I say the government itself, which collectively are in excess of 20% of the nation's GDP, which according to McKinsey, Vijay, suggests that we have not seen the kind of productivity gains in those sectors as you'd otherwise expect to see given what we've learned on retailing and other sectors that have embraced information technologies.
Sure. The McKinsey Global Institute put out a recent analysis on this. They talked about dramatic potential for productivity increases
Yes.
In what they call quasi-governmental sectors like healthcare. I'm sure
Yes.
the government may not like that qualification, but let's talk about healthcare for a little bit.
Please.
Again, looking at the power of the networks, there has been a lot of attention and money spent on the move towards electronic medical records.
Yes.
But I think you have ideas that go beyond that on how maybe even in a bottom-up way we can see empowerment of the individual as the patient driving this. Can you give me a couple of ideas on what kind of initiatives the government is doing with in the medical space?
Well, thank you for that, Vijay. So we have this combination of a strategy where we're digitizing the nation's healthcare system, and a number of stakeholders are engaging. It's a $20+ billion program that's part of the Recovery Act. And as Vijay described, that's essentially a top-down initiative. We've got funding in Washington, we got rules, procedures. Money is now flowing to doctors and hospitals throughout the country. But he's asked the question about bottom-up change. And a lot of what we're talking about in the power of networking and information technologies as it applies to healthcare may actually come from some of these bottom-up initiatives. The one that comes to mind is what the president calls the Blue Button Initiative. In August of last year, the president spoke to the Disabled Veterans of America. It was a speech where he announced the end of the combat mission in Iraq, apropos of tonight, the conversation that we're going to have about Afghanistan. And in that speech, the president said to the Disabled Veterans of America that he challenged the VA to allow veterans to, at the push of a blue button, to download a copy of their personal health data. Because the VA has a pretty advanced electronic medical record system, and it invites individuals, to about 1 million of them, to have personal health records where they store some basic information, their medication history and the like.
Now, this is great. As you say, the VA has been a pioneer. A lot of Americans don't actually know this, but
Yes.
they were a pioneer in digitizing records, using electronic decision support systems and so on. But you know, if I got a blue button, I'm in the private sector healthcare system here in Manhattan, I press the blue button, I won't get anything because my doctor is all paper. So how's this going to help anyone?
Well, so what's powerful about this bottom-up change is the president issues the challenge, the VA accepted it, October 7th it went live, our partners in the DoD and Medicare followed. Over 300,000 Americans have downloaded their blue button. So Vijay's saying, well, what's in it for me? Well, this is becoming a grassroots movement. 2 weeks ago, Aetna, the largest repository of personal health records, they have 10 million users, announced that they were going to blue button their database. And not to be outdone, the CEO of Walgreens flew down to Washington to announce that he too would blue button the Walgreens database for personal health records. So overnight, effectively, within a year, over 10 million people will have access to this capability. Now, in the spirit of where we are, rough consensus, running code, the spirit of the internet, it doesn't have your entire medical record. It starts with your medication history. In the VA's case, in the DoD, they're going to have lab data and others. But my point, Vijay, is that while we have the larger vision to digitize the system, and we have seen the numbers of physicians that have adopted going from 20% of the American physician to 30% adoption in a year, we have this bottom-up movement to liberate some information so that actual networking and information technologies can be put to work to bring meaningful applications on that information.
And we've seen, I think, at places like Kaiser Permanente, where they have forged ahead with system-wide records,
Yes.
better patient outcomes. And that's really what the point of this, right?
It's better outcomes at lower cost. And just today, a contest was announced by, I had the pleasure of announcing a contest at the Mobile Health Summit last November. And the Research and Development Center at Harvard that won an award from us for R&D, it was called a Sharp Institute. They had a contest using an API that they published in March, so less than 90 days. If you liberated information, in this case medication data, what innovative apps could be useful for you? And today they announced the winner of their contest, a little $5,000 contest. It was more to spur entrepreneurial activity. Meducation, an entity that created essentially an industrial strength, high quality app that takes your medication information and it provides for you in 30 languages patient education materials. So Vijay, if you didn't speak English and you showed up in an emergency room and they had this app running, again, built in 90 days, very simple capability, you could get in Portuguese, in Spanish, in other languages, the relevant information. And medication errors in the outpatient context are a problem in our healthcare system.
Yeah.